Painful periods are the most common complaints by women who have periods. I feel like it's not giving the utmost recognition it deserves because periods are normal, right? And you feel a little bit awkward telling someone, I can't go to work, I can't go to school, I can't come out because I've got period cramps. And you feel kind of judged because they believe that it is a normal pain that you should get used to. Guys, this is not a normal pain a woman should get used to because it is terrible. In this video, I'm going to take my time to explain what painful periods are, the two different types of painful periods and the differences between them, causes of painful periods, home remedies to help yourself with, how to treat it, and when to visit the hospital for expert care because it is abnormal for your periods to be so painful that you can't carry out your normal daily activities. Hi everyone, what's up and welcome back once again to my channel. This is Get Value with Nurse Chinyere, and in this channel we talk about everything health. If you are new here, this is Nurse Chinyere Mary Ann, a registered nurse, a registered midwife, a registered public health nurse, and a bachelor's degree holder in nursing science. It's good to have you here, and to my returning subscribers, you guys are phenomenal. Thank you for sticking around. Now let's get right into it. Menstrual pain, which is also known medically as dysmenorrhea, is a cramping pain in the lower abdomen or pelvis which occurs before or during menstruation. There are two types of dysmenorrhea. We have the primary and the secondary dysmenorrhea. In primary dysmenorrhea, a woman feels pain during menses, but there is no damage to her pelvic organs. That is, organs in the pelvic region like the uterus, the fallopian tubes, ovaries, and so on. These organs are in perfect condition. This pain is characterized as dull cramping ache in the bottom of the stomach that sometimes radiates to the lower back or thigh. I want to bring our attention to why a woman feels pain in the lower back or thigh since she's not menstruating in those areas, right? She's experiencing what is known as referred pain. It is a pain that is felt in one part of the body when the source of the pain is from another body part. This is as a result of a shared nerve supply to both body parts. In primary dysmenorrhea, this is basically why a woman feels pain. There is a natural chemical produced in the body known as prostaglandins. They are usually produced in higher quantities during menstruation. It stimulates the contraction of the uterus to enable it expel blood during menstruation. In this case, these blood vessels are already narrowed, meaning that the amount of blood that is supposed to go to the uterus is limited. When there is limited blood supply to the uterus, this also means that there will be limited oxygen supply to the uterus and pain is felt. On the first day of a period, the level of prostaglandin is high, likewise the level of pain. As the period advances, the level of prostaglandin goes down. That is why pain tends to lessen after the first few days of a period. Another factor that can cause pain is when a woman suffers from heavy periods that blood clots are passed, especially the big ones. It can be painful to pass because the uterus has to contract more in order to expel these blood clots out of the cervix, which is like a tiny hole. This cervix is just like an opening to the uterus where menstrual blood flows out to the vagina. Every content in the uterus has to be expelled through the cervix. Most times, these blood clots are bigger than the opening of the cervix, like I said before, and the uterus has to put in much effort to expel these blood clots out of the cervix. When this happens, so much pain is felt. There are risk factors associated with primary dysmenorrhea. When I talk about risk factors, I mean those characteristics that increases your chances of having primary dysmenorrhea, like family history of primary dysmenorrhea. Maybe your parents or someone in your family had it. It also means that you are likely to have it too. Others are women who smoke, women that take alcohol during their periods, women that are overweight, those who had menarche before the age of 11, that is those that started seeing their period before the age of 11, and women who have never been pregnant before. Now let's go over to the secondary dysmenorrhea. In this type of dysmenorrhea, the cause is as a result of some abnormalities in the pelvic organs. It's either there is a problem with the uterus, the fallopian tubes, or the ovaries. Remember we said earlier in primary dysmenorrhea that The pelvic organs are in perfect condition. But now there is a problem with these organs. Let's look at the pattern of this pain. This pain may begin a week before the period starts, then gets worse as the period continues, and may not go away after the end of it. Now let's go over to the causes of secondary dysmenorrhea. The major cause of this is endometriosis. Sounds like a big name, right? Okay, I'll try my best to break it down. The uterus has 3 layers. We have the outer layer, the middle layer, and the inner layer. This inner layer is just like a thin lining, and it's this part that breaks down into blood during menstruation. In endometriosis, this inner layer, which is supposed to be inside, right, finds itself outside of the uterus, which is abnormal, and during menstruation it will still break down like the way it is supposed to. But the major problem now is that there is no passageway for the blood to leave the body, and this blood accumulates in the pelvic area, causing so much pain to this woman. Another cause of secondary dysmenorrhea is adenomyosis. It is very similar to endometriosis, but it is rare. What happens here is that the inner lining, which is supposed to be the innermost part of the uterus, right, it finds itself in the middle layer, which is more of muscle. This lining will still break down like it should during menses, but the only problem now is that there is no passageway for the blood to leave the body. Therefore, this blood accumulates in this middle layer, causing so much pain to this woman. Another cause is pelvic inflammatory disease, which is infection of the pelvic organs. It is usually as a result of an untreated sexually transmitted infections, which finds its way from the vagina up into the pelvic organs. Other causes of secondary dysmenorrhea are uterine polyps, ovarian cysts, fibroids, and so on. Let's talk about some home remedies and self-care tips to help yourself with. These remedies will work if your own type of dysmenorrhea is the primary one, because there is no problem with your pelvic organs. But if your own type of dysmenorrhea is the secondary one, I'll advise you visit the hospital to get expert care. Some self-care you can adopt are positioning. You can assume a comfortable position of your choice. For some, it can be lying on the side or on the back. Just any comfortable position that suits you is okay. The next one is exercise. I know that some people will be like, exercise under this terrible pain? You mustn't take the rigorous ones. Simple exercises like stretching, light jogging, walking, or even yoga can be of great help. The importance of exercise can never be undervalued. During exercise, hormones that makes you feel good, known as the endorphins, are released from the body. Endorphins act like the body's natural pain reliever. Secondly, during exercise, there is enough oxygen supply in the body. The uterus, deprived of oxygen as a result of the action of the prostaglandins, we get enough oxygen supply, indirectly reducing your pain. You see? Next is hot water massage on the lower abdomen. You can place a hot water bottle wrapped in a cloth on the lower abdomen. This can also help with the pain. To avoid direct contact with the skin that may lead to skin burn, it is advisable to wrap the hot water bottle in a cloth. When these home remedies doesn't work, you can try some medications like the NSAIDs, that is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, and so on. These medications helps to inhibit or reduce the production of prostaglandins. But before you take NSAIDs, or if you have any medical conditions like ulcer, gastritis, asthma, bleeding disorders, or if you are allergic to aspirin, it is better to check with a medical practitioner to ensure that these medications are safe for you. NSAIDs can as well be combined with paracetamol. Paracetamol alone is weak in controlling period pain, but when combined with NSAIDs, a better result is achieved. Next is the use of oral contraceptive pills, that is when analgesics did not work. It is better used in people that are not ready to give birth because it will stop ovulation from taking place, and when this happens, prostaglandins is not produced, and when it's not produced, there will be no pain. Alright, so I've come to the end of this video, and I hope you all got absolute value from this video. And if you did, kindly give a thumbs up to this video. Share this video with your friends and families who are having painful periods, and drop a comment in the comment section. The last but not the least is Turn on your notification bell to be the first to see my videos whenever I post valuable contents like this, because that's what we aim to achieve on this channel. Alright? See you all in my next one. Bye!